Hi, I'm Lily Head, and welcome to another one of my dental business transaction podcasts. All our podcasts are available on our website, lilyhead.co.uk, and they are basically discussions with industry experts and colleagues on a variety of subjects relevant and topical right now. Podcasts are available very simply. You can download them through Apple, Podbean, Spotify or Google Podcasts, and there are some videoed versions of our discussions through our YouTube channel, so please do download and follow. And today I welcome back Eddie Crouch, Chairman of the BDA. Morning, Eddie. Great to talk to you again. How are you?
I'm very well, thank you very much. Still very, very busy, but thankfully I'm in good health, and I've had my first vaccine obviously a few weeks back, and many of my colleagues have had them. So we're hearing about 80% now of the dental teams have been vaccinated, so that's good news.
I'm waiting for my letter yet. We're great. I never thought I looked forward to having an injection, but I really am. That's brilliant.
Yeah.
How are you coping, Eddie? I mean, I know how busy you are. How are things?
Yeah, it's full on still. I had an evening meeting on Monday, got an evening meeting tonight, I've got an evening meeting yesterday. So, 3 evenings in a row, still doing sort of a huge number of hours every day in meetings, and trying to sort of catch up with clinical things as well. I was in practice Monday morning, I was in practice yesterday morning. Juggling a bit, I'd say, is how I'm coping at the moment. But I'm getting more into a pattern, I think. The real thing about the situation at the moment is obviously because we can do so many meetings like this, it's nothing like what people were doing previously. My predecessor, Mick Armstrong, used to go to London an awful lot to meetings, but it wasn't so easy to organise meetings at a drop of the hat. And so my volume of meetings has been huge. I'm managing to contribute. I'm getting lots of information from the people I'm meeting. I think we're making some progress on various things. We're not making progress on everything, but I'm pretty pleased with the way things are going, really.
I was going to ask you, what would you say is, as an overview, what's a typical week in your life, a week in the life of Eddie Crouch?
Well, even at times when I'm not at meetings, sometimes, for example, this afternoon I'm going to the Scottish Dental Practice Committee, and there's probably about, 2 to 3 hours reading ahead of some meetings like that, where you've got to read the papers so you can contribute really well to the meeting and understand what's happening there. On Friday, I've got a meeting that's virtually going to extend all day, and the papers for that are probably going to take me the best part of half a day to read, so that I can contribute. So preparation work for that, as well as I'm in practice still, finding that more and more difficult to deal with, but I still enjoy seeing patients. In a good week, I might do 2.5 days in practice. Some weeks I'm only doing half a day, and I've got very, very supportive teams around me who will pick up when I'm not able to go in and see the patients. So I work in very supportive environments where other members of the team see patients if they've got problems for me, and that's great. It's they're incredibly supportive, and without them, I probably couldn't do the things that I'm doing at the moment.
It's about that support of teamwork, isn't it? Being able to lean on them. In your role at the BDA, what kind of support do you have? Do you have sort of a secretarial or administrative backup support?
Yeah, all of the committees have allocated secretaries. So depending on which committee is meeting, they will have an allocated secretary who does all the background work and puts all the papers together and the minutes of the meeting and things like that. But I have someone at the BDA who's fantastic, Alison McGee. She organises my diary for me, and slots in requests for meetings and things like that, and juggles me around when I need to be juggled around, and gives me plenty of warning when I need to cancel things, with clinics. So
she's like Miss Moneypenny.
Yeah, I mean, Alison is fabulous. I mean, she organises the diary of the chief executive and the president of the BDA and me, and often she has to juggle some of the diaries of my vice chairs as well. So. Yeah, she without her, I think the whole system would fall apart. You always need someone like that, don't you?
Otherwise, you'd just go crazy, wouldn't you? Really, with the pressure of everything. And this sounds a daft question to ask you, but do you manage to sleep all right at night? Because I often find the busier you are, the more active your brain is. Do you find that you're absolutely exhausted when you hit the pillow, or is your brain whirring, ready for the next day's challenges?
Yeah, I rarely have a problem in going to sleep. I mean, sometimes, for example, if you're going to do a big media interview on the breakfast sort of media in the morning, it disturbs your sleep because you're thinking through what sort of questions you might be asked and how you might answer that and how you approach it. And despite the fact that you know that you are going to know far more than the person who's asking you the questions, there's an element of doubt that you'll get something wrong, you'll get a fact wrong, you'll get something wrong in the interview. And social media is a great supportive place, but if you do get something wrong, they let you know about it. Yeah, it has been brutal for me and for other colleagues, but also it's been a fantastic avenue to actually get information out to people. But I generally go to bed at night and I'm pretty knackered, and I hit the pillow and I do go to sleep. But I do find I probably wake up, a little bit earlier than I previously did, with my mind getting active for the day ahead.
I'm glad you do. What sort of media can we look forward to seeing you on shortly? Are you going to be on the TV shortly again with anything else? Any other releases or information broadcasts?
Well, I think the big thing at the moment is still about the target issue that that's been enforced on dentists in England, the 45% for general dental services and the 70% for ortho. Healthwatch have been really supportive, actually. I mean, they've done quite a lot of work which shows the problems that patients have had, not only through the pandemic, but also after the pandemic. Since we've gone back since the 8th of June, it's been difficult. And they've, bizarrely, Healthwatch rarely produce reports about one issue twice in the same year, but they've done 2 reports recently on dentistry because of the problems that are there. And I've been talking to people at Healthwatch, Sir Robert Francis, who did the inquiry into the Staffordshire issues with the mid-staffs inquiry. He's senior now in Healthwatch, and he was on Radio 4 the other morning talking about dentistry, talking about the issues that are there, because there were issues with dentistry pre-COVID, but they've just been exacerbated. He was calling upon the Health Select Committee to look into dentistry. There was an inquiry that was started pre-election by Jeremy Hunt when he was in charge of the Health Select Committee. He that inquiry was actually abandoned because of the fact that there was a snap election called by Boris Johnson in November 2019, and we've been campaigning really for a Health Select Committee inquiry into dentistry for quite a long time since that was abandoned. Mick Armstrong, my predecessor, gave evidence to the Health Select Committee that was inquiring about the effects of the pandemic during the summer, and Jeremy Hunt said, dentistry needs to be looked at. And so we've been banging the door at the Health Select Committee to get them to restart the investigation. And this week I had a meeting with an MP from Coventry who is on the Health Select Committee, and she was very encouraged by what we were saying and interested in actually taking that back to the Health Select Committee to see if we can get that going. Monday morning I was on a phone-in with Nikki Campbell on Radio 5 Live because of the Healthwatch report about the issues of people having to wait such a long time to get into a dentist, and also some of the bad stories about people who were being coerced into having treatment privately rather than on the NHS, and how expensive that was. So it's quite difficult sometimes when you go on the media that you promote the profession as best you can, but sometimes there are some actions that have carried out by the profession that's quite hard to defend.
Yeah. Is that something that is an escalating issue with people being sort of forced, coerced into taking the private route? Is it something that you've seen a huge uptake in?
No, I think the vast majority of colleagues have tried to do the right thing. I think actually the stories I'm hearing at the moment, I was talking to an orthodontist the other day, and they hadn't taken on a new private patient since the 1st of January because they're so focused at the moment in hitting this 70% target for the units of orthodontic activity that they need to deliver before the end of March. But I mean, there are circumstances where, most practices work in a mixed model where they rely on the private support of their income to actually continue to provide NHS services. And sometimes I think the problem is with communication to patients, because if 50% of your week previously was devoted to private treatment, and you've got spaces in your diary on those 50% of days, patients perceive that they're being denied the treatment on the NHS and being coerced into private treatment, when in reality it's because there's availability of appointments in their private element of their diary which weren't there or are not there in their NHS diary. So patients perceive that they're being tricked into having private treatment. But we know, I mean, pre-COVID, the budget for NHS dentistry only covered half the population anyway. So we had a problem pre-COVID, and it's just got worse with the effects of COVID.
Looking ahead, Eddie, what are going to be? Obviously, this is taking up an awful lot of your time. Looking ahead for February, March, the spring months ahead, what are going to be your key focuses in your role there at the BDA?
Yeah, at a national level, we're negotiating, obviously, what's going to happen from the 1st of April. We're still not happy about the targets that have been set, and I'm really worried about practices that, deliver below 36% of their units of dental activity. The financial penalty to those practices is going to be huge. And so I'm worried about the stability of those practices. But we are negotiating with NHS England what the new contract year will look like. We've got a round table with the Office of the CDO coming up in a few weeks' time, where we're putting forward some ideas on what we think is a fair way forward to actually get more patients seen and re-establish services as we come out of the pandemic. So a lot of our focus is on that. We continue to try and argue for support for all elements of dentistry. Secondary care is in a particularly difficult place as well at the moment. I was on a meeting last night where some of my colleagues who work in hospital dentistry are still being redeployed in other areas of the health service. And, when waiting lists in secondary care have doubled since the pandemic, we need them back doing what they should be doing, treating patients for dental issues, not actually working in hospitals, turning patients over. We know that's important, but, other people within the health service should be there to actually do that work, so that these specialists can do their own work, really.
I think it's interesting to hear this because people don't have any idea of what really goes on behind the scenes and the demands on everybody. And as you just mentioned about this secondary care, this redeployment issues, that will come as a surprise, I think, to a lot of people. And I'm really heartened to hear about how much you and on behalf of the BDA are going out there fighting to helping dentists to be heard and to help them, because without that support, it really could be quite a bleak outcome for them all. So, I think that you're doing a great job, and I know how hard and passionate you work.
Yeah, I mean, the other issue at the moment that I'm really worried about is the people in dental school and the final year dental students. We've been involved in lots and lots of discussions with Health Education England and with the Dental Schools Council. We're really keen to make sure that they get the experience they need to graduate this summer. We were involved last week with a story that was breaking in Scotland, where STV picked up a story that perhaps Scottish dental students would actually be kept back a whole year. And And so we're arguing for support for those students, financially, a whole year's. I mean, dental students come out with big overdrafts generally, but adding another year overdraft to a graduate is going to really put them in a terrible place starting their career. And obviously balancing that with practices that take these new graduates into their foundation training schemes, and how you balance the numbers. And obviously a lot of foundation dentists working in general practice have had a very distorted year this year, getting experience in their first year as a qualified dentist.
Let's talk a little bit about mental health issues, because we are certainly seeing clients that are coming to us who are at various points of readiness to sell their practice. And, sadly, we do see cases when people have reached that point where they can't really do this for very much longer. What's the BDA doing to support people with mental health issues that have been really exacerbated by COVID?
Yeah, I mean, I had a meeting with Dame Clare Gerada a few weeks back. She is very instrumental in an NHS service that's there for dentists to actually get support, the Practitioner Health Support Scheme, and we were talking about the volume of dentists that were actually presenting to that scheme, and she was saying about 20 dentists a month were actually presenting with severe problems. She said it was marked that dentists, when they presented to these support schemes, were in a much worse position than any other person that presented from healthcare.
Really?
Dentists try to cope for a long period of time before they actually suddenly realise that they can't cope anymore. We are, I think, by nature coping people. We've had to be really over careers and things. But when they present, they're needing far more intense help than anyone else from healthcare at the moment. And the BDA, obviously, we provide a mental health support for members, the Health Assured program. The numbers of people that are presenting there are huge, a massive spike in the numbers that they previously looked after. And it's understandable, the pressures, day in, day out. We've had to cope with working in a completely different way, a totally different environment in the practice. Patient complaints, I think, now are starting to rise from what I hear from the GDC. Patients were understanding at the beginning, but it's got worse, I'm afraid. And patience is wearing thin for everyone, really. When you get pressures, financial pressures like this target has actually put on practitioners, that pressure increases again, and lateral flow testing of staff going off with having to self-isolate because of other members of their family that have picked up COVID. The difficulties with the weather. I mean, the weather recently has been pretty awful, and you've got a target to juggle, and you haven't got patients that are coming through the door. It's very difficult.
It's tough times ahead. Spring is coming though, Eddie.
The sun shining here in Birmingham today, and bloody cold.
-7
sun
in the night.
shining,
-7, could you believe it? Mind you, it's -35 in Calgary. We're all right. Shouldn't complain. Now, one last question I have for you. Let's talk about CQC. Because, as you know, I've been discussing with you, there's even bigger delays in CQC. So thank you, by the way, for your reaching out to CQC to bring it to their attention about the issues there, holding up delays of people's sale transactions. What's the latest your end?
Well, I'm still waiting for an official response to the letter that you. I think you've promoted that letter, and thank you for promoting that. What we're trying to do. Yesterday, I had a conversation with senior people at CQC, and they were very apologetic. A lot of their staff who were involved in the re-registration process have been seconded to other areas of the CQC, and the workforce that they've had to deal with the backlog has been a problem. But they're promising me that is about to be sorted out. They tell me that what the figures that you gave me, that some of these practices have waited, from September early October to actually have their application actually looked at. They're telling me that they are working hard now to try and get through a backlog of applications. They're telling me also that they're going to prioritise the ones with transaction dates or dates that are imminent rather than doing them on a. So they're basically triaging the applications to find the most urgent to look at. So that may help you.
That's music to my ears, Eddie.
I mean, I think the whole process was something that was wrong for quite a long time. It's been far too complicated, and the other promise I got from them yesterday that they were going to try and look at the whole process and try and streamline it and make it far easier. But they tell me that they've already looked at about 1,000 practices in their remote inspection process that they've been doing, and they've got about 27 inspectors working in whole-time equivalent on doing that. So it looks as though probably that aspect of the CQC activity is actually working quite well, but this registration process needs sorting out.
Well, that sounds very heartening. That's good news. I'm certainly going to deliver that to my team. And thank you very much for your input on that, because, sometimes you just need to poke a stick through the bars, don't you, and give it a bit of a rattle, and you've got the great result. So let's watch this space.
Yeah. One of the great things now is that, people do respond when I write a letter or I send an email. The authority of the job actually carries quite a lot of weight, thankfully, and people don't ignore. As Eddie Crouch, dentist in South Birmingham, sending an email, it didn't really cut it sometimes.
You're being modest. You're not a man who gets ignored readily. I know that much about you. That's great. No, but well done.
No, I'm persistent. I am persistent. I don't drop anything because if I sense unfairness, it's always been in my makeup to actually pursue a point until we get some sort of answer. Last night I was on a meeting with NHS England, and we were talking about the clinical input that's actually been put into NHS England's theory and modelling about how these targets are achievable. And, a simple question asking who actually has given them the clinical input for orthodontics? Who was the high street orthodontist or someone working in primary care that told them that 70% activity in a UOA contract was deliverable? And I didn't get any answers. No one could give me a name of anyone that had given them that advice. And, I'm not going to let that drop because, when a minister stands up in Parliament and says these targets have been put forward with clinical input, we need to know who these people are that are giving that clinical input, and I won't let that drop.
Well, that's all very good to hear, Eddie, and thanks again for your time. It's really great to get an update. It sounds to me like there is a little bit of light peeping through there, a bit of sunlight coming in for us all. Keep up the very hard work, and again, lovely to talk to you. Hopefully we'll catch up again soon, perhaps in a couple of months, see what's happening in the springtime. And I'll be able to report back to you on how CQC submissions are going our end.
Yeah, please do keep me informed about that.
No, that's great.
And thank you again, Lily, for a lovely chat.
No, it's lovely to talk to you. Thank you very much, Eddie. And thank you to our listeners, our valued clients. I hope you've enjoyed this discussion today. Don't forget you can listen to this and a variety of other topics on our Business Dental Transaction podcast series, available on Apple, Podbean, Spotify, and video versions on YouTube. And of course, if you need any advice at all or want to discuss any matters surrounding yourself, whether you be looking to buy or sell a dental practice, we can be reached at dentalbrokers@lilyhead.co.uk. Thank you for listening. Goodbye now.